Hello, Viva Angels.
Hello, angels. It's Sam and Lizzie here.
Here to talk to you about a Dermaplane today. This one's a good one. We're excited.
She's a good one, yes.
We're excited to talk about it.
This one's pretty epic. She hasn't been here in a while. She's breastfeeding mommy. She's also a spray tan artist, so we'll get into that as you see some of the Dermaplane. Sam's doing the Dermaplane, by the way.
Surprise!
Like you didn't know that.
Surprise! So you'll see some of her spray tan coming off because, like Lizzie was saying, she is a spray tan artist. So you're going to see some of that coming up in the exfoliation process, which makes it really fun to watch. But again, I haven't seen her in a minute. Busy new mom, breastfeeding still, so there's only so much that we can do as far as treatments when she comes in. But for all of you breastfeeding and pregnant mommies out there, just know that it's a good treatment for you guys to do, something that we can tailor to whatever you need, something specific to your skin, to your needs. But this one is a good one.
And I can't stop staring at it. I'm like, ah.
I know, it was so good. We got so many layers. I could feel all those layers coming up. And you know, with doing any dermaplane on most of my patients, even if they are really oily, even if they do have a lot that they need to get off, sometimes less still is more with them. You know, you don't want to send them home too sensitive. I don't know. So I always just like to kind of gauge how things are going. I'm always constantly asking them how things are going, how their skin is feeling. Are you feeling burny? Are you feeling sensitive? Just to kind of, you know, keep monitoring how they're feeling so that I don't send them home too uncomfortable. There's no need for that, I don't think.
No.
That's just my style.
Well, especially if they're breastfeeding and they're pregnant, they want to enjoy it as well.
Yeah.
Relax a little bit, not be stinging and not telling you.
That's true. Very true. And usually I'll send them home with some type of a calming lotion for them to use if they don't have anything at home that fits the bill. But most of our regular patients have something that they can use at home.
Mm-hmm.
But
I think that's my
patients, yeah.
That's my favorite part. And it goes under the eye. It feels so good.
Mm-hmm. There's always a lot that builds up there. And under the chin, too, because we don't really worry too much about that. So whenever I go to do Dermaplane, sometimes I'll see a ton of dead skin cells coming off, and that's really satisfying.
And then she's got those big juicy lips.
Oh, the Brenda lips.
Yeah.
Queen bee. Sometimes it's hard to get around those because you guys have like, whoo, so pretty. But look at all the stuff coming off. Ooh, extractions. I forgot I did these.
Yeah.
How could I forget? So after doing Dermaplane, and you saw me Dermaplane this area already, it will take off lots of layers of dead skin cells. So sometimes it makes it really easy to get some of those blackheads or congestion out of the pores. Sometimes they'll even pop right out on their own as I go over the area with the blade. There's other videos that we have where that actually happens. So if you haven't seen that, you should, because that's really fun to watch.
Mm-hmm. They're all over our TikTok and Instagram. And
look at all those dead skin cells.
Yes,
oh, that was good.
She's probably feeling around for congestion, other hair, more hair.
Yeah, sometimes it's hard for me to tell if I've gone over the area or if there's still peach fuzz there. So I'll rub the skin because the peach fuzz will stick to the skin. So I'll rub the skin just to make sure, because again, I'm trying to avoid over exfoliation. Let me say that again, over exfoliation.
For the people in the back, over exfoliation is not necessary.
Well, that's an issue. My goodness, with product, with anyway. Getting off that soapbox. Focus, Sam.
It's hard to focus.
Focus on this Dermaplane.
Look at all that hair, though. Care.
All the fuzz, all the dead skin cells. And then it's just highlighted by us taking off the color from the spray tan, so you can really see it. It's such a good Dermaplane. And again, she's still breastfeeding her infant, cute baby boy. But this is something that we can safely do on our pregnant and breastfeeding moms. So for those of you that still ask us, like, what can I do? What do you have? This is one of those things that's okay for you guys. And I'll tailor it specific to what your skin needs. We'll never do more than what we think your skin can handle. Ever.
Here we go. This is the good side, too. so geeky. But take note, too, of how she's holding the skin so taut. A lot of times we watch girls dermaplane, and they don't hold the skin taut, and
Yeah.
it looks like they're, you know what I mean?
You kind of cringe because you're worried
Yes.
that blade's going to go and do something you don't want it to do.
Yeah.
I hear you.
So girls, guys,
People.
take note of how she's holding that skin super, super, super taut so she doesn't cause any issues.
Hold that blade flat.
And the blade flat.
Yeah, just 45-degree angle, not necessarily flat, but, 45-degree angle. The hair actually grows back at a 45-degree angle, so that's why they tell you to hold it like that, so you can get underneath that hair, and so that you can get a really good exfoliation, and you can get all of that peach fuzz off. Sometimes you have to do different angles in different areas because of the way the hair grows in some areas on some people, but for the most part, 45-degree angle, so just kind of don't hold that blade straight up, because that's not, they're going to go home with all these little tiny feels of cuts and stuff on their face, and you may not be able to see it, but they can when they go home, and they can feel it because they tell me.
Yep.
Yeah, they tell me. Why is it when I've had this done before, wherever I was up at north, because we're in Florida, so we have a lot of patients that go back and forth, and they'll ask me, why is it I feel all these little cuts and all of these little abrasions, and I tell them it's an exfoliation process. Some areas are harder than others to kind of get into, but oh my gosh, this is such a good dermaplane. It really is.
Yeah, it's a good one.
Yeah. I just got a lot off, and it's just really satisfying because I think her skin was really nice after, and I think she even messaged you and said something about it, how good her skin felt.
Yep. And then, if she wanted to do a spray tan in like a week or so, her spray tan will stick really well.
Yeah, it'll look really good, really even, because we've gotten all of those dead skin cells out. Ooh, more extractions.
Yeah, she really needed them. She, again, hasn't been here in quite a while. She was a regular. She was here every month doing her injectables and her facials and stuff, and then she got preggers, which yay. But now we're getting back on track because she's had the babies. I think you should hit too that the hair doesn't grow back.
Oh, yeah.
Differently.
So, yeah, the most common question, how long, or does it change the hair? Is it going to grow back thicker? All of these questions.
Different color.
It doesn't change the hair. Something has to happen internally for someone's hair to change. It's going to come back and look exactly as it did before I took it off. So you're not going to see any difference in the way of, the look of the peach fuzz. It's still going to be peach fuzz. It's not going to come in, like a 40-year-old man's hair. You're okay.
You'll
be all right.
You'll be all right. Come back.
Yeah, something really does have to change internally for that to happen to anybody. So
I put the extractions in because I know we have some people that like that as well.
Well, I like it, so I appreciate you.
Yeah.
Yeah, and like I said, extractions tend to be easier after a dermaplane because I have taken off the layers. I've decapped that follicle. That blackhead, in a lot of cases, is easier to come out because I've taken off that hard kind of cap cover that you see whenever you try and take out a blackhead. So sometimes it can just come right out.
It pops right out.
Hold that skin tight.
Uh-huh.
Especially in that area. That's one of the areas where when I first started, I was always like, because it's a weird angle.
Yeah.
And when I've had them done on myself, that's usually the area that would get a little rough from people with the blade, whatever, weird angles and stuff. But just hold that skin tight.
A lot of times Sam will do the brows at this point as well. I think you did do the brows, didn't you that day?
I think we did before we got started, right?
Yeah. And Jen does have her brows tinted or microbladed.
Yeah.
So, but Sam will, usually clean them up and make them just look heavenly. Look at that. Yeah.
Oh, those dead skin cells kind of coming up. I can like feel them when I'm going over the skin with the blade. It's kind of hard to describe, but I can just, it's nice. You can just feel all that. And when you try to go over it again, you feel how smooth it is after you've taken off those layers. And then you know it's time to move on. There's no reason to keep going in that area. I don't need to take that much off. Because then you risk causing injury to the skin. And if I have a patient who has ethnic skin, if they have, you know, that in their background, and you're over exfoliating that area, you can cause post-inflammatory pigment. That is not what we want to do to people. Less is more sometimes, especially with us being more medical. We're in a clinic setting. The types of products that we use are more aggressive. You know, that we've got chemical peels, things like that. So there's no reason to overdo it with things. Just less is more. And even after a dermaplane, there's not a lot that I do to people after a dermaplane. I just like to leave that skin alone. To me, the skin is compromised. I've taken off a lot of layers. I'm not putting heavy masks on them. I'm not doing microneedling on them. I'm not doing all of these other things on them. I'm leaving the skin alone. I may do a very, very mild chemical peel, but I'm going to make sure that these people know what their at-home care instructions are. I'm going to make sure that they know what to do if there's some type of an issue with the skin because it is compromised, and they know how to get a hold of me so we can keep the skin in check.
Mm-hmm. Now she's adding some hydrating cream just to make sure her skin is nice and hydrated. I think she actually washed her face after the dermaplane as well.
I've started doing that most of the time because I do just want to get that dermaplane oil off, because I want to make sure that calming cream, that hydrating cream is absorbing well, and we want to put sunscreen on. You never leave here without SPF on your face.
Nope.
Ever.
No
for
girl,
any
no,
reason.
No girl, no. And this is the big reveal. This is the aftermath. Woohoo!
Look at all that.
Bye, angels.
Bye, girls. Bye, everyone.